the front and 3 of us wearing the shirt, looking like a wow.
Purple, purple, purple. So beautiful.
So amazing.
Us looking like a wow.
Okay.
Hello, Vio.
We should have been.
Are you guys okay?
Yes.
You just finished your lab?
Yes.
Yes.
Alright, so how many hours of lecture do you have this today?
Just
3
3
hours in the morning?
now.
no, just 2 hours
Just
before this.
2 to 3?
Some of them had LPE before this.
Yeah.
Some of us just had practical 2 to 4.
Oh, okay. Or, why are you guys different?
Band.
Depends on your group.
Yes.
Oh, alright.
Sorry lah. Mainly 4.5
Okay, first of all, I would like to apologize. This lecture is supposed to be given to you last week or 2 weeks ago.
2 weeks
Yeah, but something cropped up and I couldn't make it. So thank you very much for giving me today's slot. You're supposed to be free, right?
Yes.
So those who already have plans, I'm sorry. You have to endure with me.
Where's
I
the
will try
slide?
my best to
Where's
complete
the slide?
everything in 1 hour, if it's possible. Yeah, but let's make it an open session. If you have any questions, please raise your hand. Yeah, you can straight away ask me. But basically, what I'm going to share with you today is about ethics in medical and health research. Very much focusing on ethics in research. Yeah. So this is actually part of the series of lecture related to your research methods. Okay. Before I go into the subject matter, I just want to check with all of you. You have got your groups already for your research?
Not yet.
Not yet. So you don't have any name for your supervisor yet?
Not yet.
Okay. You have any idea what research you want to do?
No, doctor.
No. Okay. Some lecturers will ask you, what is it that you like to do? What is your interest? But I'm pretty sure majority wouldn't know what you want to do. Yeah, you will follow what your lecturers suggest. So I'm gonna keep the session as general as possible to accommodate various types of research. But you've got your talk on research, right? Research methods, the various types, cross-sectional study, clinical trials. Yeah? So for this semester, what is the outcome of the course? Are you supposed to come up with a proposal?
Yes.
Yes. So when is that?
Proposal.
Next time?
No.
No, this semester. Can? Oh, when is this
Presentation. Proposal presentation.
Proposal presentation is when?
January 12th.
February.
January.
So not long from now. Yeah, January. But when are you going to get your group? Not sure. Groups and supervisor, not sure. From Julian has met you all.
Yes.
Yes.
What is the timeline? He's not telling.
No.
But what you know is that in January you're supposed to present your proposal already. Okay. So there are 2 parts to this lecture. First part is a bit boring, talking about research ethics. I have to explain it to you so that you understand what research ethics is. But the second part is the more important part, whereby it relates directly to your research. Yeah. So most research needs to apply for ethical clearance. So I'll guide you on how you want to apply for the ethical approval, yeah, and what forms you need to fill out and so on. Okay? Alright. Okay. Ethics. In general, it's a bit term, right? People talk about whether this person is ethical or not, whether that behavior is ethical or not. Yeah. So basically, what is ethics? How does ethics differ with law?
Law, control,
Any offer? Well, basically, ethics is about is the principles of what is right and what is wrong. It's very general kind of principle. As compared to law are written regulations. Yeah. So for research, we don't have any specific law, to conduct research as or to see whether this research is following certain regulations or not. But we do have statements on research ethics. Yeah? So when we talk about medical ethics or research ethics, there are two types. One is ethics in clinical practice, another one is ethics in research. Ethics in clinical practice, you're going to get more from PPD. Yeah? So I'm going to touch on research ethics only. Yeah? Alright. What is research ethics actually? Yeah? We talked about ethics just now. Ethics is the principles of what is right, what is wrong. Yeah? And when we talk about research ethics, it is actually a field of study where we talk about norms, values, rights, the good and bad things of doing a research. Yeah? So research ethics is very much into that. Yeah? So why is research ethics so important? Why do we want to make sure that students or anyone who conduct research abide to research ethics? Yeah? First of all, we need to know what is research. Why is it important to do research? Apart from having to pass the assessment, or you have to come up with a report to do a research. Yeah? So research is actually bigger than that, yeah? Whereby people use research to find answers to certain health problems, yeah? To certain questions, yeah? To provide findings to help mankind to progress, right? So that's research, and research is very important for us to move forward, for us to find answers, credible answers to questions that we want to know. Yeah? But when we do research, yeah, one of the important elements of research is someone need to volunteer to be research participants, right? So these volunteers, we call them subjects, or we call them participants. And while we want to reap all the benefit of research, we need not forget that we need to protect the subjects. Yeah? Historically, last time when scientists were doing intervention studies or trials, they were needed to experiment on themselves before they experiment on others. Yeah, that was 200, 300 years ago. Yeah? Because ethically, they say you don't want to try something that is harmful to other people. It is unethical to try something which you don't know whether it is beneficial or not, whether it is harmful or not to other people. So you have to try it on yourself first, or on your family members first. So that was last time. Yeah? Now it's not like that anymore. So people have progressed, but there are certain rules and regulations that we need to follow before we want to do experiments or do research on subjects. So as I said just now, it is very important to respect the subjects' dignity, their safety, their privacy, to make sure that your research meets the minimum ethical standard that is required. Alright, so these are the theory of principles of research ethics. Basically, it is just expanding earlier points that we have mentioned, that I've mentioned just now. First of all, do not do bad things. Yeah, all research, principles, the basic principles of research. First, you cannot conduct a research which can be harmful to your participants. Next is beneficence, meaning that all research must show that it is of some kind of benefit. You can't just do a research without any purpose and you don't know whether it's going to be beneficial or not. Yeah. The third good principle that you have to abide is that your participants need to have their autonomy, so they can choose not to participate in your research. Yeah. Well, when we talk about autonomy, sometimes when you do research in vulnerable group, we call them, yeah. So these people have their ability to decide is jeopardized. For example, who are the vulnerable groups? Any guess? When we do research, who are the vulnerable group?
Elderly.
Elderly, yes, elderly. Why are they vulnerable? They might be weak, but if their intelligence is okay, their cognitive function is okay, they might be physically weak, but mentally they are not challenged, so they are not considered as vulnerable as long as they can decide. Yeah? But elderly with dementia, for example, who cannot really think of themselves anymore, yeah? So you cannot get consent from them because they don't understand already. So when we want to do study with this kind of group, so who do we ask for consent?
Guardian.
The carers, yeah, the carers, family members. Same as if you do study with children, yeah. So you cannot ask the child. You need to ask the child their permission to respect their own autonomy of their body. Yeah, for example, if you are doing a study among primary school children who already understand about stuff, yeah. So you can ask their permission, but on top of that, you must ask their parents' permission. Okay, so permission that you ask from adults are called consent, whereas permission that we ask from children, minors, we call it assent. Yeah, so you have to ask assent from the small kids. Yeah? So talking about vulnerable group and autonomy, are students considered as a vulnerable group in the study?
Less than 18 years old.
How is it yes?
Less than 18 years old. Less than 18 years old.
Ada ke less than 18 years?
Yeah.
Are you all children still? Tak. If you are less than 18, you are in Asasi, yes, you are considered as vulnerable. But university students, like you guys, 20-ish, or any university student, for example, why do I say that you can be a vulnerable group? You might not be in a position to say no when your lecturers say they want to study or do survey on you. You might be scared that probably by denying to answer certain questionnaire, your results might be jeopardized. You know? So you can be in that kind of position. So whenever I'm part of the ethical committee of UPM, whenever we receive ethical application from researchers, we will make sure that they declare in their proposal that if participants refuse to participate, it will not affect their marks or their opportunity to take part in certain things. Patients in the hospital, when doctors want to do study on them, some of them feel that they're obliged to take part because they are scared that perhaps if they don't take part in the study, in the experiment, the doctor might not treat them well. Yeah? So a responsible clinician researcher should ensure that regardless of the participants or their patients' decision whether they want to take part or not, yeah, the treatment that is going to be given to them will not be different. Okay, so it's a bit tricky here when we talk about autonomy. So not just small children or demented people or handicapped individuals, yeah, but normal people like us might be put in certain position where it's difficult for us to say no, yeah, in any research. Okay. Next principle, justice, fairness. What is this all about? Yeah? So when we do research, have you heard of clinical trials?
Yes.
What is a clinical trial?
Testing drug. Testing drug.
You want to test a drug.
Yeah.
Yeah? For example, there's a new drug that can cure Down syndrome. I know this is absolutely incorrect at this point of time, yeah. But katalah, there's a new drug which can cure Down syndrome. So you have a group of Down syndrome individuals. You put them in two groups. One is control group, one is trial group. Control group and trial group. Yeah. So in RCT, randomized control trial, the people in the trial group will receive the medication, the tested medication, to cure their illness. Whereas the control group will only receive placebo. Yeah? Imagine suddenly after giving the medication for 2 months, all your patients in your control group, in your trial group are cured. Whereas, do you want to just stop the study and let your participants go? Is it fair for the trial group? For the control group? It is not fair, right? So it has to be embedded in the study protocol that if the drug can show benefit, you have to give, after the study has completed, you have to give it to the control drug. Yeah? So when designing a research, you need to think all that to be fair to your respondents. Yeah? Later, I will share with you an example of a study conducted in the US among black syphilis patients. And we will see what are the elements that are being jeopardized in that study. Okay. Next is dignity of participants as well as researcher. Yeah, dignity. So whenever you want to do any research that involves sensitive issues or sensitive questions, you need to make sure that you keep all the data confidential, and if you have any procedure to be conducted, you have to conduct it in a proper way. Yeah. All right. Veracity is obligation to full and honest disclosure. This one, you need to explain to your participants what this research is all about. You need to be honest. You cannot just give a partial truth to your participants. This can be explained later in the example, the Tuskegee syphilis case, where we will see that veracity is being jeopardized. Yeah? Confidentiality of. Imagine if you are a participant trying to answer a survey, asking on intimate questions about yourself. Do you want your answers to be known to other people? No, right? Yeah. So the confidentiality is very important. Whenever we do research, we must ensure that to our participants that whatever that they have responded, we will not share the results to other people. Yeah? What if you do a study in school? on smoking status, for example.
Oh.
No.
And you ask the secondary school students, are you smoking or not?
Are you smoking?
And then you get all the results. And you analyze and you see that 50% of the students in that school smoke. What will you need to do? What will you do? Will you reveal the names to the discipline teacher?
No.
Are you supposed to?
No.
We are not supposed to, right? Because it's confidential. But as a researcher, what can you do?
Advice. Advice.
How?
Ada yang buat dia.
Will you share the findings?
No.
Yes.
You can.
Yeah.
You can share the findings by removing the personal identifier.
Oh.
Okay, you can share the general findings. Okay, teacher, in your school, 50% of students smoke.
Damn.
Nanti the teacher will ask you.
The
siapa?
school is tobacco factory.
Of course, they want to know the names. You
The
cannot
school is
reveal the
tobacco.
names, but you can reveal the general findings, the anonymous general findings.
My Leo does.
Okay? So
What's that?
that is how we convey results. Later, when you do your own research, you will see that in our report we do not put any personal identifier. Okay, we will just use generalized data, generalized results, the percentage, mean, standard deviation, range,
LEOD.
yes, but not who
No.
whose data is that. No, we're not going to reveal that. Okay.
M. No M.
Communication. All right. When we say that we comply to good research ethics, we must have very clear communication to our participants. How do we do this? For all respondents, before they answer their questionnaire, if we do a questionnaire survey, you need to tell them what the study is all about. And it is in a form, we call it informed consent sheet. Consent informed respondent information sheet, sorry, RIS. Yeah. So that respondent information sheet should have all the information about your research, and it has to be prepared in a very clear layman term. Yeah. If your respondents are laymen, you need to suit the language so that they can understand what you want to tell them about the research. Similarly, if your respondents are small children, standard 3, standard 4, you cannot use your bombastic medical phrases to explain about the research to the students, to your participants. Okay? So it is very important to have clear communication. Alright, some historical background on research ethics. If you look at the table, under case are all the ethical violations or the classic cases of ethical violation in research that has happened previously. And the right column are the guidelines or codes or declaration, regulation that came out as a reflex to the violation. Yeah? So one of the most popular research ethics issue is the Tuskegee syphilis study. Have you any lecturer has explained to you about Tuskegee syphilis study? What happened? No? Have you heard about it? Have you Googled out of curiosity? Okay. In this study was conducted in the US by the United States Public Health Authority. It is not by some random researcher, okay? This is by the US Public Health Authority, conducted in 1932 to 1972, 40 years of research. Now, what did they do? So in this study, they enrolled black males who has syphilis symptoms. The aim of the study was to look at the natural progression of syphilis, natural progression of untreated syphilis. That was the aim of the study. Okay? So, when they recruited the man, they told the man that in this study, we are studying a bad blood disease. They are not even telling that it is syphilis. So the participants were not informed that the diagnosis is syphilis. That is one. So after telling all these stories, nanti we go back to the principles just now and we will look at what are the points under the basic